7:35, and we turn now this morning to a growing health concern in Texas. It's now raising alarms across the nation. A measles outbreak has been reported, with cases on the rise in multiple communities. So far, there has been one death, a child who had not been vaccinated. I just checked with the Texas Department of Health's website just a few minutes ago, and so far, 146 cases have been reported since January, with 20 patients hospitalized. Now, back here at home, you might be wondering how this outbreak could impact us here in the DMV. So joining us this morning to talk more about it is Emily Smith, a professor at the Milken Institute of Health the Milken Institute School of Public Health at George Washington University. Professor, thank you so much for joining us.
Good morning.
So I was just really surprised to even learn of this measles outbreak in 2025. It just seems like something that we had taken care of. Where was the United States prior to this outbreak as far as measles and mumps and rubella and all those vaccinations?
Yeah, this has been a growing problem, a coming problem. So measles, we essentially got rid of it. It was declared eliminated from the US about 25 years ago, meaning we really weren't seeing cases, we weren't seeing outbreaks, we weren't having transmission like this. And in recent years, vaccine rates have been falling, and we're starting to see more and more of these outbreaks. And this is one of the biggest outbreaks we've seen. This is the first time we've seen a death from measles in a decade. So it's really serious, yeah.
So we know that the child who unfortunately did die was not vaccinated. I had to look it up. As a child, I had mumps, but I was sure that I was vaccinated. And what I learned was that you could still get mumps if you were vaccinated. What about the measles?
That's true. So the measles vaccine is really good, and we have decades and decades, more than 60 years worth of data showing us that it's safe and effective. So if you have 2 doses of the measles vaccine, it's about 97% effective. So it's really good. And even with just 1 dose, the vaccine is about 93% effective. Now, it means it is possible to still get sick, to still get measles, even if you're vaccinated. But in the case that you're vaccinated and got measles, you're way less likely to end up in the hospital or end up in the morgue. So, but in general, you're unlikely to get the measles if you're vaccinated.
We know there's some conflicting advice out there. Years ago, parents thought, is this a direct link with autism, things like that? So what is the bottom line advice from your purview about getting your child vaccinated?
Absolutely. Get your child vaccinated and get your child vaccinated on time. And now, given the growing outbreaks in the US, is a good time to make sure they're up to date with 2 doses of the MMR vaccine. It's true, there was this study which has now been shown to be fraudulent. So there was this old study suggesting a link with autism. It's now been reproven that there is no link between this vaccine and autism. As I said, 60 years of data showing it's safe and effective. And so bottom line, get vaccinated. Now is a good time to get up to date if you're not.
All right. Professor Smith, thank you so much for joining us with that important advice for parents. Thank you.